Thank you, Honourable Speaker. I want to thank the Cabinet Secretary for appearing and answering these questions, Honourable Speaker. Honourable Speaker, my concern is on the response that the CS has given, particularly in rehabilitative services and assistive technology for persons with disability. Honourable Speaker, my question to the CS and successfully help these persons living with disability. The first thing that needs to happen is a proper assessment so that the assistive devices that are given are then appropriate. I would like to know the position of the ministry in regards to establishing proper assessment centers in this country, Honourable Speaker. I'm aware the only assessment center that government has is the one available at the Kenya Institute of Special Education. But considering that is used for assessment and training, therefore it limits the availability of that facility for purposes of assessment. What is the ministry doing to ensure we have at least, if not in every county, every region, a proper assessment center so that persons with disability can be able to access it? Honourable Speaker, I'm asking that question because we once in my county did an assessment of children with hearing impairment, and we had a total of 3,000 children who were brought for that assessment. To our other shock, 2,300 of those children could actually hear with just an hearing aid being provided. But these are children who have missed to go to school. These are children for the last 10, 15 years they have not been hearing. They are hearing for the first time when they are over 10 years, and their lives has been made difficult because of failure to have the assessment facility. I would like to know the position of the ministry on that matter.
Honourable CS.
Thank you, Honourable Speaker and Honourable Members. I acknowledge the question. Previously, assessment was only at one level, at the ministry. But right now, the assessment has already been devolved. So each county has a team, multi-stakeholder team, multidisciplinary, that has been trained to do assessment for disability. And I am informed that this has been happening now for the last 2 years. And we continue to build capacity of those multidisciplinary teams at the county levels to be able to do assessment. But equally, we have assessment being carried out at all the level 6 facilities, which are 6 in the country. So on the 47 plus 6, that means that then we have a total of 53 assessment places where assessment of disability can be done. The ministry, however, continues to do appeal cases where an assessment has been done in the county and the person is not satisfied with the results. The Ministry of Health at the national level, we work on the appeal cases. I submit, Speaker.
Senator Methu.
Thank you very much, Honourable Speaker. And I thank the CS for a very elaborate answer to the question. And I actually went to consult Senator Mbugua because he's the man that saw the question, so that I am able to ask a question that is relevant. And my question to the Honourable Cabinet Secretary. Last week, Honourable Speaker, and allow me from the onset to thank you that you allowed us to do the red ribbons in celebration of the Dyslexia week last week, Honourable Speaker. And I'm very saddened, Honourable Speaker, because in my opinion, I did not see anything. Or anyway, let me ask it as a question. What did the Ministry of Health do for creating awareness on dyslexia? Because you know, Honourable Speaker, dyslexia is a condition that has many times been misdiagnosed. Senator Mbugua and I attended that particular celebration at the Kenya Institute of Special Education, which again, Honourable CS, is important to note that you and your ministry was not represented. At least Parliament was represented because Kedipa was there, but the ministry was not represented. I did not see them doing anything in terms of awareness. And also finally, I would want to know whether the Cabinet Secretary is aware that 100 kids that have this condition of dyslexia do not have a school to attend in January because the Kenya Community Center for Learning that has been taking care of them has been, Senator Mbugo is well aware of this particular challenge. They have been driven out of the place that they have been using as a school for the last about 5 years. At least the other time they were helped by Kedipa, but we have not seen the ministry do anything in terms of supporting children living with dyslexia. Honorable Speaker, one of the very talented kids that was presenting in that dinner that the ministry was not represented was actually is the best swimmer in Kenya. He got an award of being the best swimmer in Kenya. She's from Nyeri. And when she first went with her mother to hospital, she was misdiagnosed to be a person that has a mental challenge. So tell me, Honorable Speaker, a person with a mental challenge is the best swimmer in the Republic. So the misdiagnosis of dyslexia is a big problem, and I would have expected the ministry to join the whole world last week in creating awareness.
Honorable Sears.
Thank you, Honorable Speaker and Honorable Members. I appreciate Senator Medhu for bringing out the issue on dyslexia as one of the disabilities that do exist. Honorable Speaker and Honorable Members, as a ministry, we follow the World Health Organization calendar of celebrations of specific days within the health sector. And dyslexia is yet to be put in the World Health Organization calendar of days to be celebrated. However, we continue to provide and create awareness in the day-to-day activities. But I would also like to say that as a ministry, we would like to take a whole of health approach, that we are not highlighting just one of the disabilities and celebrating or creating awareness around it, but rather looking at the whole area of how do we mainstream disability into the health sector and the health services. Having said that, Honorable Speaker and Honorable Members, it has been acknowledged that children with the dyslexia, if not identified early, then they may not reach their full potential. And I want to acknowledge the one that has been highlighted by the Senator as being the best swimmer. So we want to acknowledge and say that as a ministry, we are really going to work with the 100,000 community health promoters that we have trained, that they should be able to identify these cases early so that they are brought out, so that then alternative ways can be devised on which the children can be assisted to reach their full potential. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, allow me to congratulate the Minister for successfully midwifing the launch of the universal health care. Mr. Speaker, it looks like it was always going to be a woman minister who would preside over this process, because I recall you and I, in the good old days, it is when Charity Ngilu was minister that she came up with this attempt to have universal health care. So I congratulate her. Having said that, Mr. Speaker, the minister is aware that one of the need that is required by people living with disability in as far as access to reproductive health care is concerned is that a large percentage of them require assisted delivery, the mothers. They require surgery. And the biggest impediment, Minister, is the cost of access to that surgery. Do you have a policy in the same manner that you have for children under 5, so that when these people living, these women living with disability, when they go to the healthcare place, they are not denied charges because they cannot afford? Thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. Indeed, I do acknowledge that women with disability require assisted delivery. As the government, we have 2 programs. One is Linda Mama, which takes care of all women in terms of delivery. And actually, it begins from them being able to attend clinics, delivery, and even after delivery, they are able to attend clinics. This financial year, Honorable Speaker and Honorable Members, the government put 4.98 billion for support of Linda Mama. Secondly, we have government subsidy, health insurance for people living with severe and disability, that they are able to access health services. But having said that, Honorable Speaker and Honorable Members, one of the acts that was enacted is the Social Health Insurance Act. And in that act, we have developed benefit package to ensure that every person is taken care of. Those who are unable to pay, the government is going to work on a program to ensure that they are able to pay for them to be able to access services. Equally, in that Social Health Insurance Act, we have the Primary Healthcare Fund that ensures that all primary healthcare, level 1 to level 3, is publicly financed, to mean that people will not have to pay any out of pocket to access services. I submit, Honorable Speaker.
Honorable Boy.
Asante sana Mheshimiwa Spika kunipa fursa hii. Kwanza Mheshimiwa Spika, nataka toa shukrani zangu za dhati kwa Waziri wa Afya kutupatia fursa sisi watu wa Kwale. Kama seneta wa Kwale pia natoa shukrani kwa niaba ya watu wa Kwale. Siku ya Cancer Awareness Day ilisherekewa katika kaunti ya Kwale nchi nzima, yani jumla katika hiyo siku ya Kwale, yani Cancer Awareness Day ili katika Kenya ilisherekewa katika kaunti ya Kwale, Msambweni Referral Hospital. Yangu kwa niaba ya watu wa Kwale natoa shukrani yangu kama seneta wa Kwale na gavana wangu kwa waziri kutupatia fursa sisi watu wa Kwale kwa siku hiyo kusherekea na sisi pamoja. Asante sana waziri, asante sana.
Honorable Senator, you are supposed to ask a question, not to render your appreciation. Senator Tabitha.
Thank you, Mr. Speaker. And let me start by really congratulating the CS for the great job that he's doing. And as a female leader, we are very proud for our female leaders in the Kenya Kwanza government, especially on the bill that